Good morning, everybody, and welcome to the 23rd Annual Webinar Series aimed at increasing awareness, recognition, and prevention of musculoskeletal disorders. Each year that we hold this event, it astounds me. I can't help but reflect that over the last 23 years, when we first held this event, we had 20 people in attendance. Today, we're broadcasting to over 35 different countries with over 1,000 unique registrants when looking at our 4 sessions combined, removing any duplicates. This year, we're providing 4 distinct weekly sessions covering a variety of topics, with today's session focusing on 2 musculoskeletal disorders, carpal tunnel syndrome and thoracic outlet syndrome. There will be some time allotted between sessions and then an open question period at the conclusion of the second presentation. Please post any questions that you may have in the chat box, which is being monitored. We also ask that people stay muted during the session. And also there'll be an evaluation survey link posted in the chat during the session that we ask you to complete. We use your feedback as a method to improve our sessions, as well as look for suggestions or topics for future RSI Day events. Now, let's begin. Now, the carpal tunnel anatomy is important to understand in order to truly appreciate the actual disorder itself. So the carpal tunnel is actually an anatomical structure and is bounded by the carpal bones of the wrist, the finger flexor tendons, the synovial sheath that surrounds each tendon, the median nerve, the transverse carpal ligament, and both the thenar and the hyperthenar muscles. Now, the finger flexor tendons slide within the synovial sheath. The role of the sheath is to reduce friction and irritation of the tendons by secreting a fluid called synovium. Now, both occupational and non-occupational risk factors can cause an irritation response within the tendons that causes the synovial sheath to secrete a fluid called synovium. This acts to reduce friction and irritation acting on the tendon. However, since the carpal tunnel is a fixed space bounded by the bones and the transverse carpal ligament, the fluid has nowhere to go, and as a result, can actually begin to compress and squeeze on the median nerve. Now, there's 3 main symptoms of carpal tunnel syndrome. The first is numbness and tingling sensation in your fingers and hands. This usually occurs within the thumb, index, middle, and the inside half of the ring finger, but not in your little finger. There's also sometimes a sensation like an electrical shock in the fingers, and the sensation may travel from your wrist up your arm. These symptoms often occur while holding a steering wheel, phone, or newspaper, and they may even wake you up from your sleep. Many people will try and shake out their hands to try and relieve their symptoms. The numb feeling may become even more constant over time. The third symptom is weakness, with some people having a tendency to drop objects. This may be due to the numbness in your hands or the weakness of the thumb muscles that require the pinching. These are also controlled by the median nerve. The carpal tunnel syndrome is actually diagnosed through a variety of different means. The doctor will focus on your wrist to see if the area is tender, swollen, warm, or discolored. When doing a physical examination, they may also perform a number of physical tests, the first being called Tinel's sign. The doctor will tap or press on the median nerve. If your fingers tingle or if you feel an electrical sensation, the test is positive. Another physical test is called Fallon's maneuver. This is performed by having the patient place their wrist in complete unforced flexion for at least 30 seconds. If the median nerve is entrapped at the wrist, this maneuver will reproduce the symptoms of carpal tunnel syndrome. Another test is called the two-point discrimination, which may be conducted to see if you can tell two objects that are touching your skin at two distinct points instead of just one. The doctor may use a device called a two-point discriminator, which can be a flat edge or an 8-sided tool with needle-like prongs sticking out from the ends. You may do several tests on each finger. They'll start with 2 points touching the skin a few centimeters apart, and then move them closer together until you only feel 1 point of pressure. The distance at which you can feel only 1 point will help them to determine the nerve function and the compression level. The doctor may also use other tests, such as X-ray, ultrasound, or MRI, in order to rule out other causes of the hand and wrist pain. An X-ray is used to show arthritis or a broken bone, while an ultrasound or MRI will show a swollen or compressed median nerve. Another test that can be used is blood work. This is often used to look for diseases such as diabetes that can also cause damage to the median nerves. Now, when a clinical diagnosis is not clear, an electrodiagnostic test called electromyography or an EMG may be performed. This test can leave you with a very uncomfortable sensation, much like when you hit your funny bone. With this test, electrodes are placed at the elbow, wrist, and on a finger. An electrical stimulation is passed down the median nerve, and the electrodes record how long it takes for the signal to travel from point to point. This is then compared to an average value for a normal nerve conduction test. If the signal achieved is slower than the normal average, you may have carpal tunnel syndrome. The speed of the signal will often be used to classify the level of compression, which often ranges from mild to severe. Now, carpal tunnel syndrome is a unique disorder in that there are both many risk factors that can contribute to its development that are occupational as well as non-occupational. The contribution of each risk factor individually is unknown as of yet. It is currently believed that there's a synergistic or additive effect that leads to its development. For example, if a job requires awkward wrist postures plus forceful gripping, the two together will increase the development. Before work readiness can be established, non-occupational risk factors must be examined. It's important to note that people with no underlying conditions can develop carpal tunnel syndrome, and people with underlying conditions can still have carpal tunnel syndrome develop, which is often impacted by the occasional risk factors, especially if the condition is more severe in the dominant hand. Now, non-occupational risk factors for carpal tunnel syndrome include diabetes, hypothyroidism, fluid retention for pregnancy, which will normally rectify itself in about 3 months after giving birth, menopause, high blood pressure, arthritis, fractures of trauma to the wrist, lupus, birth control, estrogen replacement therapy, smoking, obesity, gender. Women have 3 times the risk of developing carpal tunnel syndrome compared to men. Age. Most people tend to manifest carpal tunnel syndrome between the ages of 40 to 70. An overactive pituitary gland, alcohol abuse, poor nutrition, certain hobbies, and having a small anatomical carpal tunnel space. Occupational risk factors include force, repetition or prolonged actions that do not allow for sufficient recovery time, awkward postures of the wrist such as flexion extension, radial or ulnar deviation, exposure to hand-arm vibration, prolonged pinch gripping, prolonged use of gloves, and finally, a contact stress. Now, one of OHCOW's primary services is to actually assist injured workers with the determination if their compensation claims are work-related. And in the 35 years that OHCOW has been around, we've actually amassed quite a database with respect to musculoskeletal disorders. So I had an opportunity to go through and look at the number of claims that were referred to us that were just for carpal tunnel syndrome. And it turned out that 16.4% of all patient referrals are related to carpal tunnel syndrome. Now, 77% of the carpal tunnel cases came from manufacturing, construction, healthcare, public administration, transportation, mining, retail trade, and accommodation food services. The specific industries were industrial or non-building construction, building construction, general medical or surgical hospitals, nursing care facilities, municipal or regional public administration, petrochemical manufacturing, elementary, secondary schools, motor vehicle part manufacturing, postal service, and public administration. 92% of the carpal tunnel cases claim from the following occupational classes: trade, transport, and equipment operators, occupations in manufacturing and utilities, sales and service occupations, business, finance, and administration occupations, and finally, health occupations. The specific occupations: welders, steam fitters, pipe fitters, electricians, occupations that support health services, custodians, heavy equipment operators, assembly line workers, construction trades, and farm workers. Now, carpal tunnels, there's a number of non-surgical methods that can be used to treat carpal tunnel syndrome. The first being the use of wrist splints to hold your hand in a neutral position, especially at night. Mild pain medications or anti-inflammatories can be used. Treating the underlying condition that you may have, such as diabetes, arthritis, or hypothyroidism. Steroid injections into the carpal tunnel area to reduce inflammation can be tried. Various stretching exercises. Vitamin B may ease some symptoms of carpal tunnel syndrome, and ultrasound treatment. Now, carpal tunnel surgery is considered when symptoms are still present after a period of time, of several weeks to months, or when there are severe symptoms such as persistent loss or feeling of coordination in the fingers of hand, no strength in the thumb, which can all restrict daily normal activities. There are two main types of carpal tunnel surgery. The first is the open tunnel release, in which the transverse carpal ligament is cut, which releases pressure on the median nerve. An incision is made at the base of the palm of the hand, which allows the doctor to see the transverse carpal ligament. After the ligament is cut, the skin is then closed with stitches. The surgery is performed under local or regional anesthetic. With carpal tunnel surgery, you do not typically need to stay in the hospital. After surgery, the hand is splinted and wrapped, and the stitches are removed about 2 weeks after surgery. The hand will be unavailable for use for a few weeks, which is often why most surgeons will only perform one hand at a time. Pain and numbness may go away right away after surgery, or may take several months to subside. So you want to try and avoid heavy use of your hands for up to 3 months. The timing of return to work depends on whether the surgery was on your dominant hand and your work activities, but often on average about a period of 6 to 8 weeks. It is often advised, though, to return to lighter duties if possible post-surgery instead of returning to the same job right away. A common complication is that there may be loss of strength when pinching or gripping an object due to the cutting of the transverse carpal ligament. Endoscopic surgery uses a thin tube with a camera attached called an endoscope. The endoscope is guided through a small incision in the wrist. The scope allows the doctor to see the structures, such as the transverse carpal ligament, without opening the entire area with the large incision. The cutting tools used in the surgery are very tiny, and they're inserted through the small incision. The transverse carpal ligament is cut, which releases pressure on the median nerve, and the small incision at the base of the palm is then closed with stitches. You can often expect a shorter recovery period with endoscopic surgery compared to the open procedure because the incision itself is much smaller. Typically, with endoscopic surgery, you can return to work sooner compared to the open procedure. Research studies have found that one procedure is not better than the other. Now, prevention should include being aware of signs, symptoms, such as numbness, tingling in your hands, especially at night, and seeking appropriate medical attention. Also, report it to your Joint Health and Safety Committee so something can be done about it. Most people tend to think, oh, I'll just ignore the issue. It'll get better with time. The problem is, it doesn't. If you don't address the underlying cause, be it a non-occupational risk factor by going to your doctor, or an occupational risk factor and reporting it to have an investigation performed, it's not going to get better. It's actually going to get worse. So having an ergonomics assessment performed in your work area is very important for prevention. Maintain a neutral posture of the wrist by avoiding flexing or extending with radial or ulnar deviations. Avoid pinch gripping. Alternate from high-intensity hand tasks to tasks that are less intensive. Try and reduce exposure to vibration through isolation and using anti-vibration gloves or anti-vibration sleeves that go over the handles of the tool. Increase education and awareness about the risk factors, causes, and symptoms of the disorder. Consider using different design tools that can allow for neutral postures of the wrist. Use fingerless gloves or gloves with PVC dots that allow for tactile sensation. Now, with the next part of the presentation is going to look at some of the educational as well as preventative tools that we've created to help reduce the potential for developing carpal tunnel syndrome. The first is we've developed 2 educational videos that are found on our YouTube channel. The first is on CTS anatomy and symptoms, and the second is on risk factors, both occupational and non-occupational, as well as prevention that are available. One of the main risk factors for carpal tunnel syndrome is actually temperature, because temperature reduces blood flow going into the extremities. So we developed something called the cold stress calculator, which can be found on our OHCOW website. You just have to go to Apps, Tools, Calculators, All Apps, Tools, Calculators, and select the cold stress calculator. Now, why did we create this? Well, as the speed of wind increases, your body will notice a decrease in temperature because the wind over the skin helps dissipate heat from the body. To understand how cold it is, wind speed is combined with temperature to calculate a wind chill temperature. The wind chill provides an estimate of the cooling power of the environment and thus plays an important role in the cold stress risk assessment and preventing workers from severe adverse health effects such as frostbite and hypothermia. The calculator was created as a simple means for determining what precautions should be taken to protect workers from cold stress related to adverse health outcomes. By entering the outdoor temperature, wind speed in the calculator, we're able to estimate the adjusted temperature or wind chill. The temperature and wind speed information can be obtained from accessing your current weather information. And the calculator will then determine the adjusted temperature, risk to workers, potential health outcomes, and recommend precautions. Now, there may be times when access to wind speed information is not available, but you can still know the temperature, for example, via your vehicle's temperature sensor. And then using the table that's included in the calculator, you can estimate the wind speed. For example, uh, if your wind is felt in your face and a wind vane begins to move, you can estimate the wind speed's about 10 kilometers. If large branches of trees move, telephone wires whistle, or it's hard to use an umbrella, it's around 50 kilometers an hour. So when we open up and use the calculator, what we would do is put a wind speed of 15 kilometers an hour, and let's say it's minus 20 degrees outside. This would give us an adjusted temperature of minus 29 degrees. So minus 20 with a wind speed of 15 kilometers an hour means we have a wind chill of minus 29. So at minus 29, this means that there would be a high risk of frostbite for most people within 10 to 30 minutes of exposure. Health concerns, there's a high risk of frost nip, or frostbite. So to be sure to check the face and extremities for numbness or whiteness. High risk of hypothermia if outside for long periods without adequate clothing or shelter from wind and cold. So the recommended precautions, dress in layers of warm clothing with an outer layer that is wind resistant, cover exposed skin, wear hat, mittens, or insulated gloves, a scarf, neck tube, or face mask and footwear that is insulated and waterproof, stay dry, and keep active. Now, this is just an example of the tool actually in play. So in this example, we're entering a wind speed of 10 kilometers an hour. And that tells us that the adjusted temperature, as we start changing it, changes. And as a result, so do the actual risks and recommendations and health concerns that the worker could be exposed to. And if we adjust the temperature, we're going to see once again a change that happens with respect to the potential outcomes. Now, another tool we developed is the glove size calculator, because if you remember when we talked about preventative measures for the carpal tunnel syndrome part of it, avoiding prolonged use of gloves was one of the recommendations. So again, this tool can be found by clicking Apps, Tools, Calculators, Ergonomics, Apps, Tools, and then selecting the glove size calculator. So gloves are often a necessity for many occupations, especially outdoor workers, and was one of the recommendations for being used based on the cold stress calculator. However, when a glove is too small, it can restrict movement and blood flow by exerting pressure on the hands. It limits dexterity, increases sweating, can lead to fatigue of the muscles, and a lack of tactile sensation. When too large, the glove reduces finger dexterity, reduces grip strength, reduces productivity. Often people take gloves off that don't fit or are uncomfortable, but then end up with a reduction of protection and safety. And of course, the loss of tactile sensation. Now, the one-size-fits-all approach to gloves doesn't work when you're dealing with such a physical, diverse workforce. Now, concerns regarding gloves. With the loss of tactile sensation, a worker will often grip harder in order to feel what they're coming into contact with. Poorly fitting gloves increase the amount of force required by the muscles because they have to work harder to compensate for the loose or tight gloves. Vibration. With the loss of tactile sensation again, a worker will often squeeze the handle of a vibratory tool harder in order to feel what they're doing which tenses the muscles. This extra tensing of the muscles will then increase the rate of absorption of the vibration into the hands since it's no longer a soft structure but has become a rigid one. With respect to grip, non-slip gloves reduce the need for extra force or adjustments to the body posture, eliminating the need for additional stresses to the muscles and joints. Some gloves have rubber nodules or touch control built into the fingertips to provide that much needed tactile feedback to the fingers. With respect to dexterity, the type of work being performed must be considered. For a low dexterity job, a 3-finger glove is often useful for increasing warmth, whereas a high dexterity job may require a full-fingered, 3/4 finger, or a glove with the sensory feedback with those rubber nodules I mentioned. With respect to vibration, gloves with a gel polymer injected cushion in the palm, fingers, and thumb have been shown to help protect against vibration exposure to the hands. Now, when selecting a glove, it's important to know the glove size. And to properly select it, you need 2 measurements, your hand length and your hand circumference. To measure them, you'll need a cloth measuring tape and also a standard measuring tape or ruler. So using either the cloth measuring tape or measuring tape or ruler, you want to measure your dominant hand. Rest your hand on a flat surface and measure from the tip of your longest finger to the crease under the palm and record the measurement. This will be your hand length. For hand circumference, we need to use the cloth measuring tape. You want to measure on your dominant hand. Place the beginning of the tape, or at 0 inches to centimeters, just above the inside of your thumb in the crevice between your thumb and index finger. Wrap the tape all the way around your palm from the starting point above your thumb to the outside of your pinky finger and back again. Check where the measuring tape overlaps itself at the starting point and record this measurement. You then want to look at those 2 measurements and determine which one is larger, because that's the value you're actually going to use. You're then going to compare the measurements to the table based on gender at birth. So for example, if someone was female at birth and the larger of the 2 measured values was, for example, 7.6 inches, that would mean that they would use a large size glove. If someone was male at birth and they had a larger value of 7.6 inches, the glove would actually be a small size. So as an example, a male at birth, hand length 8.7 inches, hand circumference 8.9 inches. Well, the larger of the 2 values is the hand circumference. So that's a value we'd actually use. And this would tell us that this person would need a medium-sized glove. Now, another tool we created is our mouse size calculator. And again, can be found by clicking Apps, Tools, Calculators, Ergonomics, Apps, Tools, Ergonomic Apps, and then the mouse size calculator. And links should be being shared in the chat how to find these tools as well. But the concerns regarding a computer mouse. A mouse is often necessary for many occupations, and selecting the correct size is important. On average, computer users utilize the mouse roughly 3 times as much as they do the keyboard. So you want to make sure that you choose a mouse that fits your hand with the right shape and size to support the natural curve of your hand and maintains a neutral positioning of both the hand and the wrist. If the mouse is too large, it can cause strain on the fingers as they must stretch to fully grasp it. If too small, it can increase the level of gripping needed to properly secure the mouse in place. Both scenarios are actually quite common and can be major contributors to undue pressure and discomfort in the forearm and wrist of the user. Again, the one-size-fits-all principle does not apply when we're dealing with such a physically diverse workforce. So this time only one measurement is required, and that's hand length. And again, we can use a measuring tape, be it metal, cloth, or a ruler. And using the same measurement technique that we did with the glove, we measure on our dominant hand, rest it on a flat surface, measure from the tip of the longest finger to the crease under the palm, and record that measurement. And we then compare it to the table. So as an example, if someone's hand length was 7.5 inches, this would indicate that they would actually need a medium-sized mouse, which is about 4.8 inches or 122 millimeters in length. Now there are alternate computer mouse designs. Now there is the standard mouse that has a merit that accommodates both left and right hand users. The limitations is it doesn't allow for neutral postures at the hand, wrist, or elbow, and can lead to contact stresses. A vertical mouse, the merits, it allows for neutral postures at the hand, wrist, and elbow, and minimizes contact stress. Limitations, it may be difficult for users to transition from a standard mouse and may require additional forearm or elbow support. They also have right or left hand mice. The merit, there's a slight curve to allow for more neutral posture of the hand, wrist, and elbow, and it minimizes contact stress, but it may be difficult for some users to transition from a standard mouse. There's also something called a roller mouse. The merit, it allows for left to right hand use, eliminates that lateral reach out or away from the body, and it can be programmable to accommodate a user's needs. The limitations, again, it may be difficult to transition from a standard mouse. It requires a training period to become proficient. It may increase the horizontal reach that a worker has to do in order to reach the keyboard, and may result in awkward postures. A trackball allows for thumb or multiple fingers to scroll depending on design. Does not require wrist movements. The limitations, it may be difficult for a user to transition from a standard mouse, may not be as effective for tasks requiring precision, and there's also the potential for overuse and fatigue of the finger and thumb muscle groups. A touchpad mouse, the merit, it allows for left to right hand use, may be a benefit for creative tasks such as drawing, but it can be difficult for, once again, a worker to transition, may be overly sensitive, and may lead to awkward postures and contact stresses. Now, another tool that we just finished creating is our interactive keyboard shortcut tutorial. Prolonged use of the mouse has been linked to the development of MSDs, such as carpal tunnel syndrome, epicondylitis, and shoulder strain. Keyboard shortcuts are keys or key combinations that you can press on your keyboard to perform a variety of tasks. Because both your hands can remain on the keyboard, using a shortcut to perform a task is often faster than using a mouse, as well as reducing the risk of musculoskeletal disorders depending on the design of your workstation. Keyboards are also universal, meaning once you learn them, you can use many of the same shortcuts across a variety of different applications. The tutorial was created to not only educate workers, but also provide them with an opportunity to see a demonstration for each shortcut in use. The tutorials were created for both Windows and Macintosh users, as well as being closed captioned, and are available in English and French. So here's an example of the tutorial in place. So you first want to select your type of computer, and say you want to learn about formatting. And we want to learn about the underline shortcut. Now, normally there's a narration that plays, but for the sake of the presentation, we just saw the closed captioning, and then we actually see the shortcut being used. So in this case, using Control U. And then we can go back. For example, we can go back to a different part, such as the functioning or shortcut, or even just moving on to the next one on the list. In this case, italicized text. Now, a lot of people don't realize this. Everyone likes to have double monitors, but you can actually split your screen to divide it in half with different programs you have in place. So you can actually have two windows open at the same time and be able to have documents right beside each other. Now, included with each tutorial uh, is a language-specific summary document for the major shortcuts, and their actions is also included within it. Again, the keyboard tutorial can be found on the OHCOW website by Apps, Tools, and Calculators, Ergonomics, Apps, Tools, Calculators, and then selecting the tool itself. Last year at our RSI Day event, we released snippets of our Office Ergonomics reference guide. This was officially released live in October, which is a valued resource available as well for help reducing the risk of not only carpal tunnel syndrome, but other MSDs as well. And that can be found by clicking Injury Prevention, Workplace Ergonomics, Office Ergonomics, and then selecting the reference guide itself. It's then divided into specific sections, or you can scroll down to the bottom and actually download the full PDF document. We also developed our Office Ergonomics calculator. And unfortunately, it's still under revisions, and that should be released hopefully in the next couple months, again, under its new format. But it's also a very useful tool for making workplace modifications with respect to your office setup. And I'd like to just remind people of our other sessions we have upcoming next week on integrating components for return to work. You can register via the OHCOW website, as well as our third session on the 24th on ergonomics for specific occupations. And then our final session is actually held on the Monday, February 28th, because this is the actual official RSI day. And I guess we have time for a few questions.
There's a question, how does menopause contribute to carpal tunnel?
Okay, great question. And it goes back to why do women have 3 times the risk of developing it than men? And the reason for that comes down to hormones. It's hormone fluctuations. So once again, with menopause, it's the loss of the estrogen, and it's the main cause of that. But majority of times, it's hormonal. A lot of it for female users that we tend to see more of it happening on average.
There's another question here, Trevor. How do you determine the size of the mouse, whether it is small, medium, or large, if you don't know the specs or the size is not labeled on the mouse itself? Also, the other thing too, is there a reference chart for what constitutes a small, medium, and large mouse?
Once again, within the tool itself, this is the reference chart. So this is based on going through a number of different websites, combining it to get the average length of every mouse that's available on the market. And a lot of them will have the size on it, whether it's extra small, medium, large, or extra large. You just have to check and also research as well. I mean, if you don't see it on a box, no, you can always go back and measure it yourself in the store. But a lot of the times when buying it online, they will state the actual dimensions of the mouse itself. So it is readily available, whether it's on the box or you may have to measure it. But these are the sort of the standard lengths of mice that you will find on the market.
Another question, Do you have advice for those of us who use our phones to type a lot? For example, this individual is using the physical keyboard on a BlackBerry.
There's a tool we don't, or a device we don't see used much anymore. Uh, no, Melissa did a presentation about a couple years ago for RSI Day on ergonomics and handheld devices. Uh, I don't know if someone's able to find that on our YouTube channel while I'm talking, but it'd be great to share the link for it. But yeah, I mean, what we're going to see is, with texting, and it really doesn't even matter the device because, you can send emails, everything through any phone, regardless. And so as a result, uh, trying to go hands-free using the dictate feature. I know like the iPhone and the Samsungs have it. Not sure about Blackberries if they have the dictating option, but that's a great way to actually get away from trying to pinch and use those little buttons. Because if you're spending a lot of time doing it, you can develop something called de Quervain's tendinosynovitis of the thumb, uh, which you want to try and avoid. And often keep any messages short when using these devices because it's going to be problematic. And in a world where everything's go go go, sometimes just I'll get back to you later, and then go to a computer is the best way to actually do that to avoid prolonged use of the keyboards on the phones.
Thanks, Trevor. Two more questions here. One that, what are your thoughts on split hand keyboards?
I know I just finished doing an ergonomic assessment for someone this week that had one of the split design keyboards. And the problem is, a lot of the times, and I'm glad you used split hand keyboard and not an ergonomic keyboard, because all too often the use of the word ergonomic is misused and misunderstood. It gets thrown on as a label on any tool or device out there. And the problem is because there's no legislation on the use of the word ergonomic, it can be applied to anything, unfortunately. And so people come out with these ergonomic tools or designs with no research actually being done on it. And I actually found a really good article that actually went into the split design keyboards and the main limitations of them. And just from personal experience, I once did a physician or an assessment for a doctor who, because of the way that the hands are being positioned, with the elbow sort of outstretched away from the body, actually developed tennis elbow as a side effect uh, of using these keyboards. So anything that forces you into sort of that posture, there's other ways that can be done. I mean, I'm a big one on proper keyboard height, getting everything positioned properly. Something I should have mentioned with the mouse as well is if you don't even do a lot of data entry, you can actually get a keyboard that doesn't have the number pad on it. So that's going to allow you to position your mouse 9 inches closer to the keyboard as well. There's also something called a left-handed keyboard where the number pad is on the opposite side. So these are ways that you can actually use these keyboards to reduce reaching out to the side when you're mousing. But as I said, with respect to the split design keyboard, a lot of things are psychological. Some people love them, they swear by them, but as I said, the research on them hasn't proven or disproven that they actually do what they're stating that they do.
Thank you, Trevor. Next question. Does CTS heal 100%, especially if diagnosed during pregnancy?
Okay, so that's kind of a two-part question because if it's just due to the pregnancy, it will rectify itself about 3 months after giving birth. And again, that goes back to the hormone fluctuations that are happening when, no, during the whole developmental period of the baby. Um, and of course, fluid retention on the joints as well. Now, with respect to carpal tunnel surgery, if it's not linked to just pregnancy, but due to it's actually due to an underlying condition or a work-related factor? The honest question is, in majority of cases, yes. However, there are the odd instance where uh, surgery isn't successful. And the three main situations are: one, there wasn't a complete sectioning of the transverse carpal ligament, so a couple strands were left in place that could still cause impingement on the nerve. Two, the person waited too long. This goes back to what I said about it'll get better, it'll get better. Well, if you wait too long and you're in the range of severe nerve impingement, you can actually develop long-term damage to the nerve that even post-surgery, you'll still experience symptoms. The third is, of course, an underlying medical condition that isn't being treated. And then finally, is that you may not even have had carpal tunnel syndrome and would actually be another musculoskeletal disorder called thoracic outlet syndrome, which just happens to be the next presentation that we're going to be discussing today.
Given how exhaustive the list of non-occupational factors is, it seems like there is a good chance most people will have some kind of history, especially as they get older. How do we assess the predominance of non-occupational versus occupational factors to evaluate work-relatedness?
Wow, that's a loaded question. I mean, first and foremost is you should rule out under any of the underlying conditions. Whether it's from an individual perspective or from determining work relatedness. Knowing what's the cause is so important because you want to make sure that we actually are able to do prevention because we don't want to see a worsening of symptoms happening. With respect to the work relatedness aspect of it, as I said, even though someone has an underlying condition, such as diabetes, that doesn't mean that it wasn't further aggravated by the work. So, for example, if someone has bilateral carpal tunnel syndrome, mild in the left hand, severe in the right, if it was due to an underlying condition, you would expect it to be mild in both hands. However, there's something occupationally that was actually acting, that person was using the right hand for, that made it more severe in that right hand. That made the severity difference. So the difference between the two hands will often be a very useful way to determine the work relatedness based on a full occupational profile of the tasks they're actually performing. And I think we'll call it there for questions. And with that, thank you everyone for attending. And hopefully we'll see you all again next week.